Hi everybody, I just wanted to hop on live and follow up about the blog post this week about yoga. We get the question a lot in here about if people need to be flexible for yoga or they don't think yoga's for them because I don't stretch, I'm not very flexible. And the big thing is, as we age, we start to lose our flexibility, strength, we lose our balance, we start to have more joint pain, arthritic type pains. And so the big thing is that yoga can be really beneficial for all of those things. You don't have to be super flexible. It's more about finding that appropriate edge with your current flexibility and working toward gaining more flexibility. You don't have to go in there and be one of those yoga superstars that are just bending backwards like crazy and doing poses that are probably unrealistic for most of us. I'm not by any means a yoga instructor or super knowledgeable. I just do it at home for fun. I find that when I do it more consistently, I see a lot of improvements in my own balance and my strength and just my flexibility in general. There are a ton of health benefits with yoga. The big things being that, like I was mentioning, you start to see a change in your balance and your stability. You start to build some strength in those legs and those core muscles, which are a big thing that we start to lose as we age and increase our risk of falling. So for all those older adults who are worried about their balance, if you can find a good course with an instructor who is able to help you negotiate through some of those things, maybe give you some tips for other ways to do the poses or giving you a chair for some added stability on the side, that's a really big and important thing that you want to find a class right away maybe that can just teach you how to do it correctly. And then as you start to feel more comfortable, maybe you don't like the class setting and you want to do it on your own. But that's what I found to be helpful for myself personally, was taking some classes first and then getting the moves down. So that way, as I went out on my own, I wasn't as worried about if I was doing it incorrectly or going to hurt myself or how to change this because it didn't work for me. The other things that we see are people with arthritis or just stiff and achy joints. Gaining that flexibility and that ability to move a little bit more fluidly and smoothly can really help reduce some of that joint pain and stiffness. So gaining that flexibility can help decrease some of that arthritic pain. There's been some good studies to show that yoga can be beneficial, especially in osteoarthritis. And then the other things it can help is just with your breathing, being able to breathe through some of these things. Again, it can be a bit uncomfortable. You want to find your edge and learn to breathe through it, but just learning to take deep breaths and to integrate our breathing into our movement. We get a lot of patients in here who, as they start to move, they start to hold their breath. They're not able to incorporate those two, and so yoga is great for trying to bring those two together, the breathing, the movement, kind of balancing that mind-body connection. So those are just a few things that can be really helpful with yoga. So check out the blog post, reach out if you have any questions, and yoga can just be a great tool in addition to doing your therapy or your own exercise program. So give it a try and see how you like it. Thanks, guys.